guys, I'm Alex. I'm just going to take like 10 or 15 minutes, maybe 20, to show you how I clean my pinsites today. So if you want to come on in, we live in a tiny house with a very tiny bathroom, so there's not too much space to hop around, which kind of makes it a little bit easier, which is kind of cool. So I normally just get started off. I have a folded towel on the seat, so I have a little more grip. I actually have a really big stack of gauze here, and then all my other gauze is just in the cupboard under the sink. So yeah, come on in. Cool. So I'm really fortunate that my shower has a handicap bar. It's like really nice and stable. If it didn't, I might get in something like this where I put both knees on the toilet and push myself into the shower. I sit down on my nice comfy shower stool. First thing I do is hop up, grab the shower head, put it on the floor, turn it on. And I just want to make sure my hands are nice and clean when I'm getting started. Yeah, so right now, normally I take all the gauze off before I shower or wash it. I do have 3 infected pinsites right now. If you get in really close, it's kind of gross. You can see all the discharge throughout the day. I am washing my pinsites twice a day right now. But because this one has a lot of discharge, I'm going to just let it soak first. So I like to clean top to bottom. I clean the top 2 pinsites, and then these 2, and then these, and then I'll clean the outside and the inside. Normally I have the water running a little bit longer, just because of the sound. I'm going to use it a little bit less. I'll take my gauze pad out. I'm very careful not to touch the top surface that I'm going to use to clean, and I just get a little bit of my soap. I really like bottled soap. I like that there's nothing that can get into this bottle and contaminate it. So let's get started. I like to hose my leg down first, and then I can either rest it on the edge of the tub or hold it up with my other leg, and then I just get nice and close to the edge. After my 2-week follow-up, the surgeon said I didn't need to use a different piece of gauze for every pinsite. So what I sort of do now, especially because it's infected, is I try to use 1 gauze per group of pins. So, like I said, normally I'll have the water running, and I'll have the shower head sort of in between my knees like this, and I'll reach down to clean. Just for the video, I'm turning the water off in between. So we got that. And then it makes it a little easier because I can bring it up for you guys to see, just cleaning the pinsites. So you can see a couple of these guys are a little bit red. I've been on antibiotics for 6 days and doing antibiotic ointment, which has been helping quite a bit. I missed this one. And then let's see if this guy's ready to come off. One thing to watch out for is the gauze is super full of holes, so sometimes it'll just wind around and get caught on the metal. So if you can just be aware of that, it'll save you a little bit of a headache. It's not a huge issue, but you're already going through a lot to clean these pinsites. So yeah, as you can see, I'm just gonna drop that down there, and that's pretty gross. And then when I'm done with that, I make sure to throw the gauze away so I don't carry that infection over to these guys are all in pretty good shape, so I'm just going to clean this as one group. So right now I am six weeks post-op, I think, maybe 5. There's still quite a bit of swelling. My stitches are out. My incisions are healing up nicely, which is good. And a lot of the pinsites are looking pretty good as well. So that is washing your pinsites. I like to smush all my gauze together and wring it out before I hop out of the bathtub. And then best way for me to get out is I'll slide this folded up towel onto here and make sure my hands are dry so I don't slip. And I put a nice knee on the comfy towel, and then I can just step out and sit right on the toilet and throw away all my gauze. And then I take this towel here and I like to just drape it around. And then I should use my crutches, but what I'll actually do is I will just hop the like 20 feet to the spot where I'm going to go and clean my incisions. So I am here on the couch with what I like to call my repair box. Supplies that I have in my repair box are sterile cotton tipped applicators, mupirocin, which is my antibiotic ointment for my infected pinsites, lots and lots of rolls of sterile gauze. I have Q-tips, just regular Q-tips, a really big bottle of saline, which you're going to need in the first 2 weeks post-op. I've got rubbing alcohol here, and if you don't know yet, you're going to find out really soon how itchy your leg and your pinsites can get. You don't want to moisturize on the pinsites or even like specifically close to the pinsites, but you can moisturize your leg around the pinsites, and it offers like a lot of relief. So the first thing I'm going to do is my favorite spot to change my dressings and do my incision cleaning is right here on the couch. I like to get these nice big pillows here, and I prop my leg up on it, and then I push myself back so I'm almost forced into this position where my leg is right up here. You should do your best to let your incisions dry out. I haven't really found a good way to dry them specifically, but I'll kind of towel off my leg in the areas around the incisions. So I haven't really found a good way to dry my incisions because I don't want to touch them with this towel because it's probably not as clean as I think. But TBD, I'll just towel off around the incisions. And one thing I do like to do is if it's a lot of moisture in there, I'll just kind of go around it with a Q-tip. 2 things I didn't mention earlier. In my box, I have this nice old stretch gauze box. And I like to just put my garbage in there so I'm not leaving like dirty Q-tips around. And I also have bio oil. It's almost out. I've been using this for ages. It's really good for scars. So I like using that as well when I'm all finished. So I will grab some cotton tip wood applicators. I rip them open like this, pull them out like that. Make sure you don't touch the tip. I like to grab this guy and just swipe them over the top. And then I put it back on the top of this Q-tip. This has been sanitized, so it's clean, which makes me feel a little better. And I like to put the lid down just so like germs and bacteria don't fly into it. If we come in really close here, this is one of the infected pinsites. Like I said, you should dry it really well. This one is not quite as dry as I would like, but I'll just go in here and swipe that on. Boop. And for these bigger incisions, see? So if you touch something that isn't the incision with your cotton swab like I just did right here, it's garbage, and I don't use it because I don't want those germs on my incision. So I'll open up another set, fresh and clean. Put a little more antibiotic ointment on it. This is pretty much how I clean my pinsites with saline. I would pour the saline into the lid of the bottle and then dip the sterile cotton swabs into the top of the bottle, and then one wipe. You don't want to revisit. You don't want to like slide around the skin. You want to just like one quick simple swipe. Just to make sure you're not like cross-contaminating or spreading germs around. I'm honestly not 100% sure how thick I'm supposed to put this on, so I might be laying it on a little bit heavy just before bed. So for this antibiotic ointment, I have been instructed to only put it on infected pin sites. I feel like there's one truly infected pin site, and then I feel like there's a lot of other ones that are a little bit red, and I would rather err on the side of caution. So if it's red, I'm putting antibiotic ointment on it. And this isn't even the best part, because the antibiotic ointment or like the saline cleansing is pretty easy because you have like a nice stick and tool. When you have to wrap the gauze, so like I can come up here a little closer, and that's like another nice thing about having the pillow, is this is like a pretty comfortable position for me. For the smaller pins, I'll just do like a couple little swabs around. This guy's always a little tricky. There we go. So this one down here, like I said, is the most infected one. So one thing I like to do, because it actually has a lot of discharge, is I'll spray some alcohol on a cotton swab, and I'll just like wipe down. I won't go near the incision, but like maybe a half centimeter to a centimeter away from the incision, just to like clean up the area, because I don't really know exactly what's coming out of there, but I'm assuming if it's oozing out of one of my wounds, I probably don't want it dripping down my leg into any of my other pin sites. So while I'm cleaning, I really make sure to keep an eye on it and make sure it's not dripping anywhere that it maybe shouldn't be. This one's always a little tough because it's like wet. It's kind of gross, but this is the position I like to get into. I can visualize is looking good. This nasty guy right here is what I was saying earlier about the itching. When I'm really tired, I have a lot less control over the itching. So while I was half asleep, I sort of just scratched myself until I bled. So that's another thing to try to really be aware of. And make sure you like get a little Benadryl or some anti-itch lotion, because it's not right on the pin site. It's super close by, and it probably could have been a non-issue had I taken care of it earlier. So the last pin sites I do are these three. It's really only this one that is or was infected. It's actually looking really good today, which is nice. I have a couple like marks like this on my leg. I'm not 100% sure what that's from. I'm assuming it's maybe the pin moving in the skin a little and tearing it. So I think I'm gonna put a little bit of antibiotic ointment on that, just because it's a little bit red, but it's not too bad. So the first thing I do when I am doing my gauze is I get some alcohol. I spray it on my hands just to clean them and get rid of a little bacteria. And then I open these guys. These are my rolls of gauze. So for my 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. For my 13 pin sites, I use 2 rolls of gauze in 5 groups. I like to just rip the gauze open. There we go. And just sit it on the couch beside me, somewhere easy to reach. Look over here. I just dropped my gauze. I dropped it on my towel. Obviously, we don't like that, so I have my alcohol spray, and I did bring my scissors this time, so I'm just going to spritz the scissors down with alcohol and kind of clip them together a couple times, and then clip this guy down here. And then just tuck it into itself. Just because I don't want to wrap that gauze that I just dropped on the towel here. So then what I do is actually just put that in the garbage. And I'll open up a new roll of gauze. Like I said, I have had pin site infections, and I just want to be as cautious as possible. This pin site is a little tough. Ugh, there we go. It's like some of you guys don't have I had the tib-fib osteotomy, so my tib and fib both got rebroken, and that's what this like second set of rings is. So a lot of you guys will just have the 2 rings, and obviously you'll have a lot more space to work with in wrapping your gauze. This is like a bit of a tight workspace here. and I'm just gonna snip that. Hold on to the scissors, hold on to the gauze, and then just tuck it. There we go. Cool. That I like to wrap those first because those are the hardest pin sites. And then this one is like a little easier because I can kind of like nestle it up a bit closer. So I slid down a little, and I slid down a little and I'm just gonna move back up. You can see like this pin site here is kind of weeping away. So what I'm gonna do is just grab a Q-tip and staying away from the incision because this one's not sterile. I'm just gonna wipe up a little bit of that discharge. Yummy yum. There we go. And like I said, I've been doing this for 5 weeks or more, and it does get easier, but honestly, some days, like right now, I'm kind of sleepy. I'm pretty tired. I'm getting ready for bed. I'm pretty over it. It's like, it's a little more difficult right now, for sure, because my mind's not laser focused. But that's okay. It's fine. We're being careful and safe, and that is good. So here I'm going to do what I was going to do on the other side, where I'm just pulling the gauze across. Yeah, I don't necessarily see that there might be an issue with this, but it is nice to me so I don't have to keep reaching for the scissors. And I also need to make sure like the scissors are in a safe place. So for me, it's just one less step. Especially like right before bed when I'm going to be taking this off in less than 12 hours. I'm kind of like, yeah, just put it on there. And I just tuck that guy right in there. Not doing much activity in this. Box and touch the outside of this. I'm just going to spray my hands again. There you go. I like doing this one last because it's just easier than the other ones. Or so I thought. And yeah, like sometimes you really can't avoid touching all over the gauze, and that's why you want to make sure you're doing this with clean hands to begin with. I might be taking it to another level by spraying my hands with alcohol, but it's whatever makes you feel comfortable. So I like to tuck everything in the garbage. This is all the supplies that I used today. I feel a little bit bad, but hopefully only have to do this once. Then I like to just close everything up. I'll put a little bit of my anti-itch moisturizer on, and I just kind of go like this, and I run it right down the sides of my legs, making sure like I don't even touch the bandages, and I go down the back. Last thing I do, I try to do it twice a day. Is I put on one drop of bio oil. Try to make sure it doesn't spread around too fast. And then I just massage it into my scar. I have a spot right here that is really sensitive, so when I rub it, it actually sends like a shooting pain down the side of my foot. I'm pretty sure, so I still massage it because it's not painful anymore. It was really sensitive right after I got my surgery for a couple of weeks. But since I've been massaging it and since my nerves have been healing, it's been getting a lot less sensitive. But my understanding is with nerve pain, you want to expose it to lots of different feelings. So like when I first broke my foot, I had like nerve damage all around the inside of my foot and all on the bottom of it. And my PT suggested walking in sand and walking on grass and different kind of textures just to get the nerves. You have to desensitize them. So like another thing that I'm doing with this is like I'm modeling the scar because it's pretty much healed. It's healed enough to be massaged. But when you massage it, it brings blood flow to the scar and it promotes healing as well, which is good. You don't want the incisions to be really raised or super tight because a super tight scar, especially right here on your anterior leg, can really limit your range of motion. So I just massage it. It's only the third time they've cut it open, so it's not my first rodeo, but it's exciting. Yeah, there we go. I would normally massage the scar on the side, but it's covered with a gauze. I'm not as worried about that. Once you do recover and you get your X-Fix off, actually, even while you're in your X-Fix, you want to be really careful to avoid sun because sun can cause additional damage to your scars. And it can also cause them to darken, which isn't like a big deal, but you know, if you want your scars to be like light and kind of fade away, you have a better chance of it if you avoid the sun or make sure you put sunscreen on. I probably wouldn't put sunscreen on this right now, but you might be able to, but I'm not sure. Anyways, we're all done. Bandaged up here, fresh and clean, ready to go. And that is all. Thank you guys for watching. I appreciate it. Hope you learned something today.